Good morning all. So today we are going to discuss about CA cervix, that is cancer cervix during the time of pregnancy. So this is Bhavani, tutor, obstetric and gynecological department, Trippuram College of Nursing, Chennai. So objectives: at the end of class, the student will be able to define cervical cancer, list the causes and risk factors, assess the symptomatic and asymptomatic cases of carcinoma cervix, explain the staging and diagnosis of cervical cancer, enumerate the effect of pregnancy on cervical cancer and effect of cervical cancer on pregnancy, explain the management of cervical cancer including nursing management. Definition: cervical cancer is a malignant tumor delivering from cells of the cervix uteri, which is in the lower part, the neck of the womb, in the female reproductive organ. Here you can see the cancerous cells in the cervix. Burden of carcinoma cervix in India. In India, cervical cancer contributes to approximately 6 to 29% of all cancers in women. The ASR is highest in Mizoram state and the lowest in Dibrugarh district. Causes: HPV, that is human papilloma virus, is a cause of approximately 90% of all cervical cancers. About half of the sexually transmitted HPVs are associated with cervical cancer. Risk factors: women has had multiple sexual partners, so these are all the people will come under the come under the risk of having the cervical cancer. Having sexual relations before the age of 18, partner who has had sexual contact with a woman with cervical cancer, smoking, weak immune system, several pregnancies, giving birth at very young age, long-term use of contraceptive pill and family history. Symptomatic cases: early month there will be a threatened abortion, and in case of in later months with cervical cancer during the time of pregnancy will cause vaginal bleeding, pelvic pain, pain during sex and antepartum hemorrhage. In asymptomatic cases, cytologic screening of all pregnant mother is a routine during antenatal checkup. Cases showing dyskaryotic smear are subjected to colposcope as directed biopsy. Staging of cervical cancer. Stage 1, cancer confirmed to the cervix. Up to cervix it will be. And stage 2, cancer includes the cervix uterus but does not spread to the pelvic wall or lower portion of the vagina. And stage 3, cancer moved beyond the cervix uterus and spread to the pelvic wall or lower portion of the vagina. Stage 4, cancer spread to the nearby organs such as bladder, rectum, lungs and liver. So these are all the stages of cervical cancer. Effect of pregnancy on carcinoma cervix. The malignant process remains unaffected. There may be a rapid spread following the normal vaginal delivery or in case of during the induced abortion. And effect of carcinoma in pregnancy. There is increased risk or incidence of abortion, premature labor, secondary cervical dystocia, injury to the cervix and lower segment leading to the traumatic postpartum hemorrhage, lochimetra and pyometra, and uterine sepsis. This may occur in the pregnancy due to the carcinoma. And diagnosis: magnetic resonance imaging, that is MRI, ultrasound can be done, that is ultrasonography, colposcopy, computerized tomography and nuclear imaging can be done to diagnose the cervical cancer. Abnormal cytology in pregnancy. Intense basal cell hyperactivity of the cervical epithelium during pregnancy. You can see here like this. You can be seeing like this, and revert back to the normal within 6 weeks. Postpartum abnormal cytology detected on routine screening is placed under the evaluation protocol. And management of cervical cancer during pregnancy depends on the stage of cancer and gestational age of the mother. It depends on these two. So one is stage of the cancer, what is the stage of the cancer, and the gestation age of the mother. So stage 1 cervical cancer, women who have tumors with a depth of invasion of less than 3 mm and less than 7 mm of lateral spread have an excellent prognosis. Okay. So in case of stage 1. So for them, we can do the cervical conization is done. That is less than 20 to 24 weeks of gestation. Uses diagnostic purpose for biopsy, therapeutic purpose to remove the precancerous cell. For both the purpose you can do. For the diagnostic purpose you can do, or as well as for the therapeutic purpose. Like cervical conization. Cervical conization refers to an excision of the cone-shaped sample of the tissue from the mucous membrane of the cervix. A cone-shaped sample will be removed from the cervix. So next is the stage 2 cancer. Pregnant women with stage 1A2, 1B1 and small 1B2 and 2A cervical cancer, that is less than 20 to 24 weeks of gestation, undergo immediate radical hysterectomy. Patients diagnosed after 20 to 24 weeks of gestation generally defer treatment until the time of delivery. In case of before 20 to 24 weeks, what we've discussed previously, we will be doing. In case of 20 to 24 weeks, after the 20 to 24 weeks of gestation, that will be different. The treatment will be different. So first trimester, radical hysterectomy with the fetus in the uterus. Pelvic lymphadenectomy and aortic node sampling is done. Oophoropexy at the time of radiation therapy may be done. Oophoropexy is nothing but ovary and tubes are separated from the uterus and attached to the wall of the abdomen at the time of radiation therapy. And post-operative irradiation following evaluation of the prognostic factors. And stage 3 and 4. So pregnant women with stage 2B and 4A cervical cancer, as well as those women with larger stage 1B2 and 2A lesions. Women at less than 20 to 24 weeks of gestation, you can initiate the early treatment. So for them, we can initiate the early treatment even in the stage 3 and stage 4. When the woman is at less than 20 to 24 weeks of gestation. And next, management for the second trimester, management decision are more difficult, and in the third trimester, radical hysterectomy, pelvic lymphadenectomy after classical cesarean delivery. Dissection may be easy, but bleeding is more often in pregnancy. Neoadjuvant chemotherapy can be done. It is a potential therapeutic consideration for patients with cervical cancer who wish to delay the treatment. It decreases the size of local tumors that facilitate the surgical management. It decreases the size of the tumor. So that is what the neoadjuvant therapy. Treatment in early gestation, particularly with the 5-fluorouracil and cyclophosphamide, has been associated with fetal anomalies. Neoadjuvant chemotherapy, continuation of pregnancy 7 to 15 weeks. That is fetal, during the time of fetal maturation, you can go for the neoadjuvant therapy, chemotherapy. And classical cesarean section with radical hysterectomy and pelvic lymphadenectomy can be done during the time of, these are all comes under the early gestation. During the time of labor, vaginal delivery should not be allowed due to cervical dystocia and injuries. Abdominal hysterectomy or classical cesarean section or radical surgery can be done. So when it comes during the time of third trimester or past the third trimester and we are nearing to the labor. So coming on to nursing diagnosis, decisional conflict related to treatment operation. What type of treatment can we can take? So that decisional conflict will be there in the patient. And acute pain related to metastasis and surgery, fear and anxiety related to diagnosis of cervical cancer, and risk for impaired skin integrity related to radiation therapy, how it will be, whether it might affect the, it will be affecting the fetus or what. So those type of dilemma will be there, or confusions will be there in the patient, and anticipatory grieving related to potential loss of life. Obviously, for all the cancer patients, once they get diagnosed with the cancer, they'll be having that type of problem. So this comes the reference same books called DC Datta and by 10 teachers, gynecology, obstetric and gynecological book. and next comes the Royal College of Obstetric and Gynecology and American College of Obstetric and Gynecology. So these are all the books that you can refer. Along with that, you can also go with the Google references. So far we have discussed about the what is the type of, what is cervical cancer, and what is the cause of the, what will be the cause of a virus that will be causing the cervical cancer, and how it spreads, and what is the diagnostic evaluation, what will be the clinical manifestation, what are the stages of cervical cancer, and in what stage what type of treatment can be given. It differs along with the stage and the weeks of gestation of the antenatal mother, and and the nursing, coming on to nursing management and nursing diagnosis we have discussed, and and last comes the references. So thank you.